Now I'm going to begin the physical head to toe assessment. So first I'm doing a general survey, and I'm looking at the appearance, I'm looking at the body structure, I'm looking at his mobility, and I'm looking at behavior. And now I'm going to start the HEENT part of the exam. We will first start with the head examination. So I'm going to inspect, and I'm looking at the hair, I'm looking at the skull, and I'm looking at the face for any lesions. I am looking for any deformities, making sure everything's symmetrical, and I'll start palpating the hair. And I'm feeling for any masses, I'm feeling for any indentations or any masses that are sticking out. I don't feel any. I'm also feeling for the hair distribution and feeling for any scars or lesions. And now I'm going to check a cranial nerve. This is going to involve the TMJ. So I'm just going to palpate on both sides in front of the ears, and I'm going to ask the patient to open his mouth and then close it and clench your teeth. And I'm going to ask him to puff out his cheeks, smile, frown, and then that checks the cranial nerve 5. Also, I'm going to be palpating the ears. I'm going to do the tug test while I'm here. And I'm also going to inspect the face. I'm going to palpate the maxillary and the sinuses, and I'm going to see if watch the patient's face to see if there's any tenderness. And I'm feeling for the skin and the temperature of it. And I'm going to ask the patient to go ahead and raise his eyebrows. Thank you. And that will check cranial nerve 7. And then I'm going to be palpating the nose, and I'm palpating for any tenderness, and I'm looking for any deviation in the septum, and making sure that everything's midline. And now I'm going to inspect the neck, and here I'm looking for the trachea, and I'm looking for the symmetry. I'm looking for any masses, and I'm looking for the thyroid gland. And so here I'm going to just palpate here and here, making sure that the trachea is midline. And then I am going to come behind the patient and check the thyroid. And in order to do this, to best palpate it, I'm going to ask the patient to swallow. And this helps me better find the thyroid. Can you swallow one more time? And I'm on the thyroid. And I'm noticing, feeling for any masses or any enlargement of the thyroid. And now I'm going to check the nodes in the neck area. First, I'll go ahead and palpate the occipital, and then I'll do the pre-articular, and then the post-articular. And then I'm going to ask the patient to turn his head to the side, and I'm feeling for any of the supraclavicular, not the super, yeah. I'm feeling those nodes, and the other side. And then I am going to feel for nodes, the supraclavicular, then the infraclavicular, and I'm noticing any enlargements. And now I'm going to go ahead and palpate, while I'm here, the carotid, each side, and I'm noting the contour and the amplitude. Now I'm going to have the patient check the range of motion and have the patient look up with his head. And can you touch your chin to your chest? And then I'm going to ask the patient to look to move his neck to the side against my resistance, and the other side against my resistance. And then I'm going to have the patient do the shoulder test, and this will test cranial nerve 11. So can you shrug your shoulders against my resistance? And he was able to do that. So now that I've tested the strength, I'm going to move on to the eye portion of the examination. And first, I'm going to have the patient do the Snellen chart examination, and this will test cranial nerve 2. So, can you cover your left eye and read the bottom portion?
LTFPH.
And cover the opposite eye and read from this line over.
HPFTL.
Great. And now I'm going to do the extraocular movements of the eyes, and this will test cranial nerves 2, 4, and 6. Not 2, 4, and 6, 3, 4, and 6. And we'll do the 6 cardinal fields of gaze. And if you could follow this item with your eyes only and do not move your head. Up, down, side to side, lateral, up, down. And I was looking for any nystagmatism as I was performing that examination. Now I will do the, if the patient's pupils are equal, round, and reactive to light and accommodation. And so first I will do the direct in the right eye, and just look straight ahead over there, making sure the pupil in their right eye constricted. Now I'm going to do the consensual and make sure the left eye constricts. And I'm going to do the opposite in the other eye. First direct, and then consensual. And we did the gorilla, and also while I was doing that, I'm also inspecting the eyes. I'm looking at the sclera for the whiteness. I'm looking at conjunctiva to make sure that that they are pink and moist. Also, I'm going to do the accommodation. So I'm going to have the patient to look at my nose, and then look at the curtain over there really quick. Go ahead and look at the curtain, and do the same thing for the opposite side. And there I was looking for accommodation to see if his eyes would constrict to accommodation whenever he was looking at a distance and then near. Now I'm going to do the ophthalmoscope examination. Here we are looking at the foveal, looking at the red reflex of the eyes. And I'm going to look at the other eye. And there I was looking for the, looking at the fova and looking at the reflex and the macula. And now we will do the peripheral examination. And I'm going to have the patient, have the patient cover one eye. I'm gonna cover the opposing eye, and I'm gonna do the wiggle test and make sure that the patient can see the finger whenever I can. So let me know when this comes into your peripheral vision.
That's it.
Okay, and let's do the other eye. Let me know when this comes into your vision.
See it.
Okay, good. And now we will move on to the ears examination. And first we will do the hearing portion of the examination. So I'll first do the whisper test, which tests cranial nerve 8. And I'll have the patient occlude the right ear. And you repeat to me what I say to you.
Apple.
And then occlude the other.
Baseball.
Yes. So you passed the cranial nerve 8. And now we'll do the hearing test. And first, we'll start with the Weber test. Which ear do you hear this best out of?
The same.
Great. And now we will do the Rhine test. Let me know when you can no longer hear this vibration.
Can't hear it.
Can you hear it?
Yeah.
Okay. So that was bone conduction versus air conduction. And the air conduction was greater than the bone conduction, which is normal. And I'll do the opposite side. Do the same thing.
Can't hear it.
Can you hear it?
Yes.
And now we'll move on. I still need to check the ears. So, with my otoscope. And for this examination, I'm going to be looking inside the ears and looking for the tympanic membrane, making sure it's pearly gray. I'm going to use the biggest speculum that I have to check inside the ears, and we're going to be pulling up and back and then looking inside the ears, check for the ears, looking for any erythema, any swelling. So lift up and back. And we're looking for the cone of light. Now we will move on to the nasal portion of the exam. And first, we've inspected the nose. We have already palpated the nose and checked the midline, making sure there's no deviation. And so now we are going to do a patency examination. So I'm going to have the patient occlude the right side and ask the patient to breathe in. Okay. And then the opposite side, do the same thing. And we were checking for patency there as well. Now, I'm going to have the patient, we are going to do cranial nerve 1. And I'm going to have the patient close his eyes. And can you identify the smell?
A Sharpie?
Yes. And now we are going to inspect the nerves with the speculum. And we're looking at the turbinates. And we're going to check for erythema, make sure that there's no swelling or edema, looking for any post-nasal drip. Okay, if you could move your head like this. I'm also going to use this. Go to the other side. And I'm looking for any perforation of the nasal septum. Okay. And now I will move on to the mouth. And here we will be using the otoscope. I'm going to be using the pin light. And I'm going to be asking the patient to open his mouth and say, ah. Stick, open a big mouth. And I did. That's a gag reflex. And we tested cranial nerve 9. And the cranial nerve 9 is definitely intact. And that also inspected cranial nerve 10 because I watched his uvula rise and fall. I'm going to ask you to open your mouth one more time. I won't put anything in your mouth, I promise. I'm inspecting the teeth, the tongue. Can you wiggle your tongue from side to side? And that checks for cranial nerve 12. And then if I had gut gloves, I would be palpating the tongue. But we checked the tongue, the gingiva, the oral pharynx. We looked at the hard palate and the soft palate. And that will conclude the HEENT portion of the examination.